Coronavirus, COVID-19, all you need to know. Countries all over the world are currently facing one of the most difficult times in world history with the outbreak of the novel coronavirus disease, COVID-19. Coronavirus, COVID-19, is a viral disease caused by a newly discovered coronavirus. The virus was first reported in the Wuhan province of China on December 31, 2019. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and may recover without requiring any special medical treatment. Older people, over 60 years, and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are at a higher risk of developing severe disease and death. The virus spreads primarily through respiratory droplets of saliva or discharge from the nose when an infected person talks, coughs or sneezes. As of the time of writing this post, a total of 1,524,161 cases of infection and 92,941 confirmed deaths were reported in 213 countries, areas, or territories, according to the World Health Organization, WHO. COVID-19 symptoms. The COVID-19 virus affects people in different ways. Common symptoms include fever, tiredness, and dry cough. Other symptoms are shortness of breath, aches and pains, sore throat, diarrhea, nausea, or a runny nose. COVID-19 prevention tips. To prevent infection and to slow transmission of the virus, the World Health Organization advise people to do the following: wash their hands regularly with soap and water, or clean them with an alcohol-based hand rub or sanitizer. Maintain at least 1 meter, or 6 feet, distance between them and people coughing or sneezing. Avoid touching their face. Cover their mouth and nose when coughing or sneezing. Stay home if they feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. WHO further advises that people with mild symptoms who are otherwise healthy should self-isolate and contact their medical providers or a COVID-19 information line for advice on testing and referral. People with fever, cough, or difficulty breathing should call their doctor and seek medical attention. Myths and facts about coronavirus disease, COVID-19. 1. 5G mobile networks do not spread COVID-19. According to the World Health Organization, viruses cannot travel on radio waves or mobile networks. COVID-19 also spreads in many countries that do not have 5G mobile networks. The virus spreads through respiratory droplets when an infected person coughs, sneezes, or speaks. People can also be infected by touching a contaminated surface and then their eyes, mouth, or nose. 2. COVID-19 and high temperatures. You can catch COVID-19, no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. The COVID-19 virus can be transmitted in all areas, including areas with hot and humid weather conditions. 3. Cold weather cannot kill the coronavirus. There is no evidence to believe that cold weather can kill the coronavirus or other diseases. The normal human body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the external temperature or weather. 4. Recovering from the coronavirus. Most of the people who catch COVID-19 can recover and eliminate the virus from their bodies. If you catch the disease, make sure you treat your symptoms. If you have a cough, fever, and difficulty breathing, seek medical care early. 5. Taking a hot bath does not prevent the coronavirus. Taking a hot bath will not prevent you from catching COVID-19. Your normal body temperature remains around 36.5 degrees Celsius to 37 degrees Celsius, regardless of the temperature of your bath or shower. Taking a hot bath with extremely hot water can be harmful, as it can burn you. 6. Mosquito cannot transmit coronavirus. There is no evidence to suggest that the new coronavirus could be transmitted by mosquitoes. The coronavirus is a respiratory virus that spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. 7. The use of alcohol or chlorine. Spraying alcohol or chlorine all over your body will not kill viruses that have already entered your body. Spraying such substances can be harmful to clothes or mucous membranes, i.e. eyes, mouth. Both alcohol and chlorine can be useful to disinfect surfaces, but they need to be used under appropriate recommendations. 8. The use of garlic. Garlic is a healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the coronavirus. 9. The use of antibiotics. Antibiotics do not work against viruses, only bacteria. COVID-19 is a virus and, as such, antibiotics should not be used as a means of prevention or treatment. However, if you are hospitalized for the coronavirus, you may be treated with antibiotics because bacterial co-infection is possible. 10. Medicines to prevent or treat the coronavirus. There is no specific medicine recommended to prevent or treat the new coronavirus, COVID-19. However, those infected with the virus should receive appropriate care to relieve and treat the symptoms, and those with severe illness should receive optimized supportive care. Some specific treatments are under investigation and will be tested through clinical trials. WHO is helping to accelerate research and development efforts with a range of partners. For in-depth coverage of, and updates on the novel coronavirus disease, COVID-19, visit the World Health Organization.